Okay, well, I could see we got some more attendance there. Thank you very much for joining me today, Southwick in beautiful Ojai, California. And the name of our webinar today is addressing specific health conditions, chronic health conditions, and specifically through detoxification. So we're going to go through specific health conditions such as constipation, rashes, skin conditions, psoriasis, eczema, kidney stones, kidney failure, bronchitis, asthma, joint pain, muscle pain, inflammatory conditions, food allergies. And then we're going to talk about the types of toxins and somewhat how these toxins are formed in the body and affecting these tissues and systems, and then how they're removed according to Ayurveda. So everything that I'm sharing here today is based on Ayurvedic principles. And according to Ayurveda, of course, the cause of almost all chronic health conditions is due to this accumulation of toxins in the body. So let me first define what are toxins. Toxins are more than just environmental toxins that we are breathing in and that we are subject to, such as in our water and our food, the pesticides, the chemicals, the food additives, the pollution in the air, the lead in the air, the chemicals in the air. These, of course, are toxic and accumulate in the body and need to be eliminated. This would include, heavy metals, even radiation and other forms of toxicity. Even parasites and bacteria, pathogens, viruses can become toxic for the body. And from Ayurvedic point of view, even cholesterol is a type of toxin, a type of, we would call LDL, or low density fatty proteins in our body. Anything that would be a type of toxin, even mucus, phlegm, congestion, these would be toxins in our respiratory system. So I just want you to first broaden your understanding of what is toxins, because it's far more than just these environmental toxins. These are accumulation of environmental toxins that we're unable to eliminate in our kidneys, our blood, our skin, our fat tissue, other places where we tend to hold these toxins. And then secondary, it's the toxins that we have made through our own metabolic processes. Like every cell in the body and every system in the body and every tissue in the body has a kind of digestive system, and it's digesting and taking in nutrients, that eliminating the waste of the toxins. So if these waste and toxins are not eliminated properly, like in the case of uric acid or creatine, or for example from the kidneys, then this can be harmful for the body. So that would count as a toxin. And anybody with poor digestion, we could say that digestion is not working properly. Maybe it's too strong and there's acidity and burning, then this is creating a toxin. Just like if you overcook food and it becomes charcoal and burnt, then you're creating a toxin. And by the way, having burnt or charcoaled food is carcinogenic and clearly toxic. And if you don't have much appetite and you're not that hungry and you're just eating anyway, heavy and slow and sluggish after the meal, then this becomes somewhat undigested food. And this also becomes clogging to the systems and the channels in the body and becomes ultimately. So all of these types of substances that I've discussed, some that we make, some that we take in from the environment, and some that just accumulate over time through poor digestion and poor elimination, become for the human body, and will then circulate through the bloodstream, particularly if they're generated in the GI tract and through digestion. And then when they circulate through the bloodstream, oxygen is circulated through the bloodstream and then distributed to all the tissues in the body. The toxins will also be circulated through the bloodstream and go into certain tissues in the body and result ultimately in certain types of symptoms and ultimately disease or damage to the tissue, and even the tissue can have a inflammatory response to some of these toxins. It could have a congestive response to some of these toxins where the system just isn't working very well and it's blocked. And also it can have a type of autoimmune effect where the immune system is continually attacking these toxins over and over and over until the point that it's actually damaging the tissue itself. So this is why Ayurveda can say that most diseases are the result of this accumulation of toxins, or ama, in the system, starting mostly with the GI tract and spreading to the bloodstream, circulating through the blood, and then lodging in different tissues in the body, and then creating these health imbalances. We're going to go through these different health conditions one at a time, and we're going to talk about how these toxins accumulate in these tissue or systems, and then how to eliminate them. Now, in previous webinars, I've talked a lot about cleaning the colon, cleaning the liver, cleaning the lymphatic system, cleaning the blood, and even shared a lot of herbs and home remedies and things that can be done. So we're going to focus less on the actual remedy here to identify the particular treatment that would be necessary for specific health conditions, such as joint pain, skin rashes, food allergies, even headaches. So let's next talk about who is suitable for detoxification. One, you have to be strong to detox the body. Shouldn't be weak and frail. You shouldn't be underweight or undernourished or completely depleted. And you should not have a systemic inflammation or a lot of inflammation. And definitely you wouldn't want to have bleeding, excessive bleeding, whether it was like an ulceration or internal bleeding in the colon. And for women, most of these detoxification procedures would not be suitable during menstruation. So you want to be strong, want to be healthy. You don't want to be too weak. Otherwise, these cleansing methods could further deplete you. So preparation is very important in strengthening the person, improving the digestion, getting the eliminating channels open and moving before you begin. And even in Ayurveda, we have a preparation for detoxification, which Ayurveda we call Shodhana Chikitsa, and part of Shodhana Chikitsa, which is kind of like the detox, is Panchakarma. And of Panchakarma, there's 5 karmas that are cleansing actions in your body. But before Panchakarma, we would practice Purvakarma, which is preparation for the detoxification. And this is very important as well. For example, if your colon's very dry, hard stools, then it's better to lubricate the body, have more ghee, have more oil, and before cleansing the colon. Same for the respiratory system. If it's too dry, then you should do this ghee or oilation therapy prior to it. And the skin too, for skin conditions and rashes, we should do steam therapy and steam the body. What this 2 procedures we call in Ayurveda means oil, also means love, loving tenderness, yeah. And then sveda, which means sweating. So before Panchakarma in Ayurveda, we do hot oil massage and then get in a sweat box and sweat. Hot oil massage and sweat box. We do this every day, back and forth for a few days. And this loosens up this toxins in the body and kind of lubricates it and literally brings it back into the GI tract so it can be flushed out through these Panchakarma methods, which include Basti or enema. And we're not going to get into these methods based on each of these specific health conditions and how detoxification can address these. So let's first talk about what are the typical signs of toxicity. Maybe you're asking yourself, am I toxic? So what are some signs that you think that your body's toxic?
Irregular bowel movements.
Yeah, irregular bowel movements. And that's good. And anything that, any part of your body, maybe you're eliminating, you have your breath is, exhalation is getting rid of the carbon monoxide. That's a toxin. If you're not able to get rid of the carbon monoxide, it's too high in your blood, it becomes like a toxin. So if your breath is smelly and you have bad breath, this is a sign of toxicity. See, the body's always communicating to us. When you're tired, you yawn. This is time to go to bed. Of course, many of us don't. We just keep yawning and working. And when you're full, the body's full, it's had enough food, it burps. It's sending you a message, you're full. If you've eaten enough, you should stop eating when you burp. And again, if you're toxic, the body will send you nice smelly smells to let you know that something's going on inside that is not healthy. Maybe this makes you less attractive to the opposite sex, I don't know. So we don't reproduce when we're too toxic, but you basically stink when you're toxic. Your breath will smell more if you have this type of fermentation and blockage in the respiratory system or in the stomach or upper GI tract. And if you sweat, this also is a type of toxicity, because our skin is a big eliminating organ, really, and it's sweating. Have no sweat and you're blocked and nothing's coming out. Well, this is, in Ayurveda, this is an imbalance. This is a blockage in your sweat tissue. Just like if you're constipated, you're not going to the toilet every day, that's a blockage in your colon. If you're not sweating, this is a blockage in your sweat tissue. But if you're sweating and it's stinky, then this is also a sign of toxicity in your tissue, in your fat tissue. And if your urine is stinky and smelly and your underwear and things, this is also a sign of toxicity. It could be even infection in the urinary tract and the kidneys, bladder, this area. And then, of course, if you're when you go to a bowel movement, if it's extra stinky and you're going, oh my God, everybody's saying you got to open a window and burn incense in the bathroom, then you have this type of toxicity in your colon. So this is a wonderful thing about the body. It's communicating to us all, telling us what's going on, even inside. And one of the key signs of high toxicity is this smells, poor smells. Also, secondary is being lethargic, slow, heavy, and of course, ultimate results of heavy toxicity is fatigue. Those are the causes of fatigue, including inflammation in the muscles and other diseases that lead to fatigue, including absorption, malnutrition, in many ways. But if the toxicity load is too much for the body, then you will be devoting a lot of time and energy to try to eliminate these toxins, and this will make you tired. Other signs of toxicity is mucus, swelling, chronic infections in the body, and of course for the GI tract, which is a low appetite, not that hungry, and not feeling like eating, not feeling good after food, and constipation. Even getting up at night and having to urinate can be a type of toxicity in the bladder. I mean, a bladder infection, that bacteria in there that's infecting you, is a type of toxin that needs to be removed. So if you have any of these signs, then these are key indicators that you need to detoxify the body. And it's, of course, best to be preventive and do regular cleansing with the car. I mean, car and the body in this regard is the same. It's better to just take your car in every 3,000 or 4,000 miles and have them, clean out change the fuel filter, and maybe every 8,000 miles, change the air filter, and, change the fuel filter every 10, 12,000 miles. And then you can avoid this accumulation of waste inside of your engine because you're changing these filters. Fortunately, with the human body, it's quite expensive to change your liver and your kidneys, dialysis for the kidneys, and that's, if they're not working, and you can always go for a liver transplant. But I think this is more risky than just ongoing maintenance. I mean, if you do this ongoing maintenance, you could have a car for 40 years. And if you don't, then eventually you could overheat and burn up on the side of the road. The engine could be destroyed, and the cost of fixing it may exceed the value of your car. And fortunately, we can get new cars, but in a human body, opportunity. So it's very good to do regular cleansing, making sure that all the eliminating channels are working well, that you're good, you're peeing regular, and it's not too dark and stinky, and you, of course, you have healthy, regular bowel movements, a couple every day. These would be the fundamental areas that you want to keep an eye on to make sure your system, your body, is eliminating properly. So let me go through now some chronic health conditions result, according to Ayurveda and my own personal experience in treating them, due to high toxicity levels. I'd like to start off with the respiratory system, our prana, vayu, sotra, the breathing system, our source of getting life force or energy of prana. So maybe you can think right off the bat, what are certain health conditions related to this, like asthma, difficulty breathing, even snoring at night. All are due to types of toxins, you know, in the respiratory system, and specifically this with the bronchial tubes and these little sacs in the lungs that transmit the oxygen and the carbon monoxide between the blood. When these are pathogens or toxins in it, which could be dust, pollen, accumulation, other toxins that you've breathed in over the years, and of course also, you know, toxins from the stomach can to the respiratory system and clog it up. Just like when we have a lot of dairy and milk and cheese, our respiratory system becomes congested. We didn't breathe in the milk, but why did our respiratory system become congested? Because, you know, there's a connection there between the stomach and the respiratory system. And, you know, physiologically, they're very close. So toxins can be absorbed into the respiratory system. And we know the body is very absorbent. You can put a little eucalyptus oil on your chest or peppermint oil on your chest and exhale out the peppermint smell almost instantly. So it shows that, you know, the tissue is absorbing very quickly, and it's going into our respiratory system, so we can absorb these toxins. So then we can have breathing problems, congestion, breathing problems, where you're having trouble breathing, and then it can first start off with simple symptoms like just having trouble breathing at night or snoring, and then it progresses, and then you could be having difficulty breathing where you have to open your mouth a lot of times, where you're not able to breathe completely through your nose. You can feel more congestion in different parts of your body that you're breathing, and so in food like dairy, you're not able to digest it. This becomes congestive and ultimately becomes like a toxin that's inhibiting your breathing. Successful with helping people with asthma and using Ayurvedic herbs. Home remedy, of course, would be like honey and black pepper. And the honey, and it's got antibacterial qualities to it. And then the pepper is hot and heating and opening the channels and helping to respiratory system. So this honey and black pepper can be taken in a syrup, and then this can be it will absorb into the respiratory system and start to clear it out, clean it out. Also, eucalyptus oil put on the chest, this eucalyptus oil to penetrate and start cleaning out these the bronchial tubes and the inner sacs inside of the lungs, and that's the ultimate objective. That's how we're in Ayurveda treating these respiratory problems, is by actually cleansing and detoxing the lungs. And that's why somebody can take these herbs for a respiratory problem for 2-3 months, and then the problem goes away. They can stop. But if they're taking inhalers or sprays or Benadryl or some allergy medication, then it only works while they're taking the allergy medication, because you're kind of suppressing the immune response. But in Ayurveda, they don't focus on this. They focus on cleaning out the lungs with this many herbs in Ayurveda. This taken with honey and taladasi, and there's different herbal formulas you mix mostly with honey, turn into a syrup, take 4 or 5 times during the day, or even up to 3 months, and this eventually the lungs, it can be quite painful, and there can be damage to the bronchial tubes and these sacs, and then it becomes a more complex condition. But you always want to deal with these health issues in the early stages every once in a while. So I mentioned this asthma first because most people don't think of this as a toxin problem. But from my clinical experience, very accurate that by using herbs to clean out the lungs, then we do have many cases, most cases of people then have improved breathing and they're able to get off of medication. So that's a very good example there. And then we'll talk about skin. Many skin conditions. We've got eczema, psoriasis, rashes, pimples, acne, and we can trace this back to generally toxins that are in the blood. So we're cleaning out the blood, and of course the blood is related to the liver and the spleen system, we could say. So the liver, the blood, the skin, the lymph are very important to cleanse, and getting the body sweating. So you want to start to eliminate the toxins through the skin by sweating. So hot tubs, steam rooms, hot baths with salts, all of these are going to detoxing the body through the skin. And then you can take internal herbs, so maybe dandelion root, milk thistle root, burdock root. There's many Western herbs that work quite well for here in Ayurveda. Bhuma amalaki, shankpushpi, kutaj, kukti, all these, kalmeg, all these can help to detoxify the liver, improve the liver function, and help to revive the liver and help it to do a better job in eliminating these toxins from the blood. So for these skin conditions, you're detoxing the blood, and there are certain herbs that can just even help to clean the blood and support the liver to improve its function, and to detox and cleanse the skin, get these type of massage and dry brushing to get the lymphatic system going. So that's why these skin conditions are very complex, because it's much harder to get the toxins out. See, when the toxins are just in the GI tract, then it's the easiest to get out. If you have toxins in your stomach, your small intestines, or even your gallbladder or your liver, I mean, it's much easier to clean these out because we have the eliminating channel of the GI tract, and we have a way to flush them out. But when they're in the skin and when they're in the fat tissue in particular, then it's harder to clean them out. Also, toxins in the kidneys. We could say kidney stones, and ultimately even kidney failure as a result of toxins. Now, kidneys are one of the most sensitive of all of our organs, and they're adversely affected by almost all pharmaceutical medications. And the side effects of many pharmaceutical medications clearly state that long-term use can lead to kidney failure. Synthetic vitamins, calcium citrate, calcium magnesiate, many of these common natural vitamins that we're taking for a long term cause kidney blockage, accumulate kidney stones, and ultimately reduce kidney function. So even taking vitamins can be toxic to the kidneys, even though you may have absorbed part of them. These are still synthetic that are considered toxic to the body. And that's why when we take a lot of B vitamins, we see our bright orange urine, I think from the B6 mostly. And when the body's expelling probably 90% of these vitamins. And sometimes they're not even digested very well. But more worrisome is this accumulation of these over-the-counter pharmaceuticals, because they're not natural. There are brands now that are natural, but I would be very just taking these vitamins. And anybody with serious kidney conditions such as kidney failure, reduced kidney function, where you have high creatine levels, high uric acid levels, generally it's recommended that you stop taking all of these multivitamins. And to improve the kidneys, of course, in Western medicine, there's no known cure for kidney failure. But in Ayurveda, one of the main procedures is to help the patient to reduce the dependence on any medication. So if you're taking pain medication every day and you have kidney problems, then you really need to start on removing this inflammation, addressing this pain, so you can reduce down your use of the pain medication, because pain medication, of course, is harmful to your very sensitive kidneys. So kidneys are very sensitive, and one of the first organs that can be adversely affected through excess toxins, particularly pharmaceuticals and synthetic substances. And we'll go to joint and muscle pain. Now, of course, most people just think of want to take Advil or Tylenol or some opiumate substance here to reduce the pain. But in fact, in Ayurveda, this joint pain is a result of toxins accumulating in your joints. So like I said earlier, this poor digestion is creating these toxins, and then they're getting into the bloodstream, and then they're going around the body through the bloodstream, and then they're lodging in different places. And one of the common places that these toxins accumulate is in your joints. So this is why a good herbalist or Ayurvedic doctor can relieve a person from arthritic joint pain, because it's not giving you just analgesic herbs to reduce the pain, but it's giving you herbs to clean out your joints, to clean these toxins out of your joints. And mostly in Ayurveda, these are the gugulu substances, Yogaraj gugulu for kind of dry, hard joint pain, and Kaishar gugulu for more inflammatory joint pain, and things like Triphala gugulu for kind of swelling, or Punarnarava gugulu for swelling type of pain. In Ayurveda, the cause of this arthritic and rheumatoid conditions is toxins accumulated in your joints. Also, when we talk about muscle pain, we could say at a certain point it becomes a fibromyalgia, but that's a label. But just tender muscles, sore muscles, painful muscles, in Ayurveda, again, this type of inflammation in the muscle tissue, as we could call it, as a simple name, is due to the accumulation of toxins in the muscles. And often this will come before the joint pain. You can have tender and sore muscles because the toxins are circulating through the blood and accumulating in your muscles and slowly accumulating in your joints too. You just haven't got the pain yet. And then later on, if you feel the pain. So often people with, I say maybe in the future, if we don't deal with this and manage it and cleanse this toxins out of your muscles, you should have some joint pain in the future. They often mention they do have a little bit, and if they don't do anything, they'll contact me back in a few years and say, you were right a few years ago. I should have continued with you because now I do have this joint pain. So just taking a painkiller is not addressing it. See, in Ayurveda, we're trying to address the cause of the bronchitis, the cause of the skin condition, the cause of the joint pain. And these causes can be traced back to these accumulations of toxins. And the accumulation of toxins is being traced back to, the poor digestion and the poor elimination of these toxins, not pooping enough, sweating enough, or peeing enough, or drinking enough water to clean that system out, or not having enough fiber to clean the colon out, or using too much lotions and things on our body that end up blocking our ability to sweat, and this accumulates toxins. So we've got to keep the body eliminating at all times. So let's do an easy one now, the colon. I mean, we know when we have blockage in the colon, we have a nice name for it, constipation. So this can be a blockage, too much processed foods, too much meat, too much animal protein, snacking, eating irregular times, eating late at night, all of these type of bad habits or poor foods or poor food combining can contribute to this blockage in the colon, which then again makes a kind of autotoxicity, because this fecal matter holding the toxins that was meant to be eliminated from the body already, the nutrients have been mostly absorbed, then remains too long in the colon, and this then reabsorbs back into the bloodstream, back into the liver, and can create a type of autotoxicity. This is often clearly seen in somebody with acne and constipation. If somebody comes to me with acne and constipation, well, we give them the herbs to clean the colon and get the bowels going, and we see very quickly the acne improves. So, you know, but even though we stop the problem, we still may have to clean the blood and clean the liver to remove the past accumulation of these toxins. Fortunately, the human body is quite robust, and it can take 20 years, maybe 30 years for these toxins to accumulate enough that you start to have a pain or inflammation. So pain and inflammation is often a sign that there's this accumulation of toxins in the body. And if it stays there long enough, then like I said earlier, the immune system can be attacking these toxins, particularly in the case of like heavy metals or other just long-term toxins. Even in Ayurveda, the thyroid problems are like low thyroid is toxins in the thyroid gland or endocrine system, and it's blocking its ability to function. And then if this isn't resolved over a period of time, then the immune system can end up attacking these toxins, and then you have what a Hashimoto's or an autoimmune condition. So this is the pathology according to Ayurveda. I'm basing this on Ayurveda teachings strictly here. So when you talk about the colon, it's very important to keep the bowels moving. But there's more than just toxins can do more than just make constipation in the colon. We can create inflammation or like a leaky gut or food allergies. Even in Ayurveda, if you're just having food allergies, oh, I can't eat a piece of bread. Oh, I can't eat anything with gluten. Now I can't have any dairy. I can't eat this. I can't eat that. Well, in Ayurveda, this is obviously a digestive problem. We wouldn't blame the brain. Often we do in our externalists. Ayurveda has a much more of a positive view of, you know, you have the ability to heal yourself, and there's a you must take responsibility for your own health. And I think this is a very important attitude, and not to just blame the bread and say all bread is bad, but to look, how come I can't digest a piece of bread? And so we could call this a type of food allergy, a food reaction. Sometimes they're just foods that are not compatible with our constitution, according to Ayurveda. But a food allergy is a type of toxin that's built up in the intestinal lining that's damaged the intestinal villi and inhibited the ability for it to absorb, or it's damaged the intestinal lining enough that it's absorbing these undigested proteins into the bloodstream because digestion's weak, so it's not being broken down properly, the fats into fatty acids or proteins into amino acids. It's not being broken down or digested well enough by the enzymes in the bile in your digestive system. Maybe you didn't even chew it enough. You just swallowed your food because you were eating too quick. And so this, you know, then can absorb through the intestinal wall, and you can get a rash, and you can get hives, and you can get a kind of an allergic reaction. It becomes toxic. Now, maybe when you bought this organic food originally, it wasn't toxic, but because you didn't digest it properly, and maybe you've had a long history of inflammation that's damaged your intestine, and then it becomes toxic. It's undigested food. Then it goes into the bloodstream, undigested. We could call it's like a leaky gut. You're absorbing undigested protein into the bloodstream, and then the body reacts, the immune system reacts, and you have an allergic reaction. So again, Ayurveda goes back. We don't have immune suppressants in Ayurveda. What we do is we clean out the GI tract, improve the digestion so it's not making more of these toxins, and then clean out the digestive system. And this is why this very famous Ayurvedic formula trifala of 3 fruits, Bibhataki, Haritaki, and Amlaki, is so helpful for digestion. People think of it as herbal formula for constipation, but it's not. It's helping to stimulate the intestinal villi in the small intestines in particular to help improve absorption of nutrients and whole intestinal lining to be able to improve absorption. So very important here to not be creating more toxins and to make sure that you're eliminating properly through the colon. Another type of toxin accumulation. Well, if you have toxins in the stomach, not the liver, not the whole abdominal area, just the stomach, you know, after before the small intestines, you know, where the hydrochloric acid is, peptic acid is, the stomach, mucosa, this area. Now, E. coli, this bacteria that's able to be treated with typical antibiotics these days, is a type of toxin that's in and living in your stomach. So many pathogens can exist in your stomach, but even too much mucus, too much congestion, often coming from animal products, poor digestion, eating when you're not hungry, eating at night, too much heavy foods, particularly at night, particularly having yogurt at night, and poor food combining like yogurt and fruit, things like this, which many people do, kind of create this mucus and fermentation in the stomach, and this becomes toxic. Even candida is a type of bacteria overgrowth, becoming toxic, and it's creating a type of toxic waste. So instead of eliminating all foods that are a little sweet and starving yourself to death, Ayurveda would just clean out the GI tract and maybe have some antifungal herbs to actually kill this excess bacteria that is in your intestinal lining. So Ayurveda would see candida as an accumulation of toxins in your body, not even though we know it's a type of fungus. So stomach toxins, it needs to be clear, joints, muscles, skin, lungs, and all of these tissue that we have in body, even our fat tissue can accumulate toxins. If you have hard, rubbery fat that doesn't come off, then maybe you've been exposed to some type of toxins or heavy metals, and this has accumulated and been stored in your fat tissue, because the fat tissue is a little bit out of the circulation. It's kind of a little storage tank there. We can store excess calories, we could say, and unused energy. It's like a stored energy that we could use at a later date, maybe because our metabolism is too slow or we're overeating. But the body can put toxins in fat tissue and store them in fat tissue, particularly fat-soluble toxins, and then this can be a reason that you cannot get off of your weight. So this type of toxins in the fat tissue tends to be very hard and rubbery, and people who have this, they feel like they're wearing like a wetsuit where there's like a hard rubbery coating over them. It's not bouncy little soft fat. It's hard, rubbery, thick fat, and this tends to be a type of toxic fat. So instead of just exercising more and eating less and things like this and other radical things like no carbohydrates and starving yourself to death, what you really need to do is you need to cleanse this fat, detox your fat, and sweating is the best way. Sweating, so exercise will help in that regard because you are sweating, and then you're but dry saunas, infrared saunas, any hot baths will all start to help to detox this fat in your body and allow it to release these toxins through the easiest channel necessary. And mostly this is going to be back into the sweat glands. You can sweat it off, and then back into the blood, or then the liver. And so, and then the brain. We shouldn't forget the brain. The brain gets toxins. There's some barriers in the brain that prevent a lot of pathogens from getting past the so-called brain barrier there in the brain. But many toxins can accumulate, and this can lead to neurological problems, and toxins are in your nervous system, Of course, there's many people that believe, including myself, that vaccines and other type of substances are adversely affecting the system of the person who's having them. And these can, the nervous system, of course, is very connected with our brain. And this can affect us and give us many neurological problems, neurological conditions. So in fact, for many of these neurological conditions, Ayurveda is kind of cleansing the body and supporting the neurological system and helping to the body to eliminate these toxins. So I don't know, maybe you have a few questions now. Shoot me a few questions. You have any questions, please?
So Kabir, you had mentioned it to be some kind of a preventative maintenance.
Yes.
So can you tell a little bit about how frequently does one need to detox the body, or what's the ongoing maintenance, and not wait for it to turn into a disease condition?
Okay, so the question is, if you couldn't hear, what would be ongoing maintenance to avoid the progression of these toxins to turn out to develop into a chronic health condition? Well, just like your car, regularity. In Ayurveda, the spring is the best time to cleanse, particularly the colon. And then during the summer when it's hot, it's the best time to flush out your bladder and your kidneys, doing these type of kidney cleanse and bladder cleanse. And the liver can really be cleansed most of the time. But, you know, Ayurveda likes to do these type of treatments when the seasons are changing, season to another season, particularly for like respiratory problems. As people enter the spring, then they get this respiratory congestion, or they enter the fall and then they have this respiratory problem. So if the respiratory system and the lungs are cleaned at this time, then they can avoid these respiratory problems. So it depends on which part of the body. But the most important thing is to be regular, to look at your digestion every day and to make sure it's strong. Your digestive fire, Agni, is like your fire that's cooking your food. And once it gets too low, then you're going to start creating more toxins in undigested food. Even too high, you're going to be like burning the food, like making it charcoal, so to speak, and that's creating toxins. So the first step is really keeping an eye on your fire, making sure it's going good so your digestion's good. Second is really making sure that you're eliminating every single day. You're not going a whole day without a bowel movement, or you're not even going all day and then having bowel movement late in the afternoon or the evening. This is really already too late. You know, with healthy elimination should be in the morning. You know, most of us urinate in the morning, but we should also defecate and have our bowel movement in the morning and get these toxins out of our body as soon as possible. We're also sweating. Sweating is a very important thing, and many people are not sweating at all. Even in hot weather, they're barely sweating. So if you're not sweating, you want to get yourself sweating. If you're not having good bowel movements every day, then you want to improve them. I have many videos on these subjects individually. So a regularity, just like with the car, just don't wait until the problem. Just stay on it on a daily basis. And maybe once a year you can do a colon cleanse. Once a year you can do liver cleanse. Maybe once a year you can do a little kidney flush with some tea to further make sure that you're keeping your systems going. That's a good question. Any more questions? And I'm checking my chat now. Any more questions?
Do these detox or cleanses usually accompanied with, say, fasting over a certain period of time, or do you still stay on a regular diet and take these additional herbs on top of that? Oh
yeah, that's a good question. I didn't even talk about fasting. Of course, I have many YouTube videos just on fasting. And fasting is a good method, not for everybody. If you're weak and underweight and thin and depleted, then, you know, fasting would be counterindicated. You know, children, pregnant women, elderly, you know, people just recovered from a serious illness or an infection, you know, wouldn't be suitable for fasting. So there's many counterindications for fasting. But overall, it's a very effective way to get the Agni going, get the fire going, and to make digestion stronger. But as far as cleansing, you know, fasting has limited capacity because you're just having, say, water. So you're kind of flushing yourself with water. So this tends to be good for, you know, your urinary system. It gives the digestive system a kind of a break, and it allows it to recover. It takes a lot of burden off of the liver. And if you're throwing in juices on top of this, vegetable juices, this can support the liver and be cleansing, but only to a certain degree. Water fasting or juice fasting, unfortunately, isn't going to do much to clean out your colon, because, you know, you could have diverticuli and diverticulitis, and you could fast and you're still going to have it when you're done. So you really need some fiber and some bulk and something going through you. So for cleaning out the colon, you really need to be eating some high fibrous food like brown rice and green mung and or a khichdi dish, so you have a high fiber diet, and then be taking herbs on top of that. And if you're a thin or underweight person, more of a vata prakriti who's not overweight, and or a person who has a strong appetite with acidity, like pitta prakriti, both of these two types have trouble fasting. One because one is weak, and the other one, they just have this strong appetite and they get acidity either, so they can't fast. So for these two categories of people, it's better that they're having an easy to digest food that they can eat on a regular basis. It's kind of like an eating cleanse or eating fast. You're still having a thin person is still having food, but you know, it's very light. That's giving them some bulk. That's helping to cleanse out the colon, nourish them so they don't feel weak and depleted, and but at the same time cleansing. So you can eat and cleanse, and you can fast and cleanse, but there's probably more limitations with fasting. But it can be very effective, particularly for a very overweight person who has no appetite and they have weight to loss. Somebody asked me on this, what about fasting for 3 to 5 days or longer? Answer, of course, to most of these questions is going to be it depends. You know, fasting, intermediate fasting, 1 day fast is probably the most effective just for getting the digestive system going again. You just don't eat Sunday, Monday morning, you're hungry. But once you start going past 3 or 4 days, and personally, I have fasted on liquids up to 21 days. And I have a lot of, and I used to do a lot of 1 week fasts, 7 days, 10 days. I was doing it a couple times a year for years. And after the 3 days, your digestive system kind of shuts down. And this allows you to keep fasting with less discomfort, because your hunger will actually drop after 3 or 4 days if you're not exerting yourself. And this can be very good for certain conditions, particularly excess weight, and to help the body to burn fat. And eventually the digestive system will come back, and you will be kind of burning fat, burning toxins. And Ayurveda, you burn these toxins off. That's why they like to use spices and spicy food, because literally off these toxins. And the spicy food and the hot food makes you sweat. You get out the toxins. The burning and the spicy food, you know, kind of makes you urinate more and kind of stimulates the colon. So that's why Ayurveda, you know, likes a little spicy and all these spices, because they are helping to burn off. So people can fast from 1 day up to even 7 days, depending on the condition. That's to answer that question. But there's many types of fasting. And like I said, I have a great video where I just talk about these different types of fasting. And a fruit fast is very effective. For example, skin conditions like psoriasis. If an overweight person with skin conditions, we do like a grape fast. You have only grapes for a week. A pound or 2 of grapes every day for a week. I mean, you've really cleaned yourself out, because you've got the fiber of the grapes. It's cleaning out your colon. You know, it's cleaning out your blood. And, you know, this is the Romans. They used to do these grape fasts as well once a year. And it's enjoyable, because if you at least you get to eat grapes. You're not starving. And it's very good at cleaning out the blood and the liver. And it helps tremendously with psoriasis. So, and most skin problems. So, grape fast. And, you know, if you have kidney problems, we do fasts on like barley water, parsley, cilantro juice, other things that will help to cleanse out the kidneys and the urinary tract. So I hope that here's another question here. You mentioned summer cleanse, bladder, kidney. Can you give more details? Well, I do have, I think, a whole YouTube video on that as well out there. Yeah, if you're having a blockage in the kidneys, kidney stones, which you can pick up from an X-ray. If you go to a chiropractor, they take X-rays of your spine, and they can see these kidney stones as well. They look like little stars. So this would be a good time to do a type of kidney bladder flush, and fasting is the easiest way. You're drinking the liquids, you're taking the herbs, you're taking whether it's parsley and barley water type of fast, and these stones, using the herbs to dissolve them and the continuous water to kind of flush them out. And this type of liquid fast is best in the summer when it's warm, and just helps the body to stay cool. And it would be difficult to do these in very cold weather, very cold climate, where you need to eat more to sustain yourself. So these type of kidney bladder problems and blockages just in warm weather. So I hope that answered your question. Please, if you have any more questions here, I think I'm on them here. Any more questions?
Yeah. So Kabir, do you find any relation type of diet that one has to the toxins that they accumulate? For example, like if a person is meat eating, or possible, like is it more probable or possible for that person to accumulate toxins as opposed to someone on a vegetarian diet?
Oh, yeah, that's a good question here. Does the diet affect the amount of toxicity that the body accumulates? Oh, definitely. I mean, processed foods are probably even maybe more harmful than eating animal proteins. If the digestion is strong and eating habits are good, you know, animal protein doesn't necessarily contribute to higher toxicity levels. But once you do have toxicity, particularly congestion, blockage, constipation, then, you know, eliminating the animal protein for even a month, or in some cases months, or even a year, may be necessary to cleanse the body. So eliminating most of these animal proteins, particularly red meat, gives the body a break, so to speak, because they're hard to digest and more congestive and blocking. I mean, meat, we know, has no fiber in it, so it can block the colon and contribute to issues. The fat in red meat, we know, can block the gallbladder and the kidney, so they're very congestive. That's why, you know, you're young and you have a young, healthy body, and you're exercising every day, and, you know, in our youth, you know, we can get away with having these foods because our digestion is strong, our physical activity's there, we don't have an old 50-year-old liver yet, you know, and so we'll do better with these animal proteins at a younger age. But, you know, old liver, 50-year-old colon, you know, then with a long history of poor food combining, poor eating habits, and eating out at nice restaurants and things like that, and not exercising enough, now you're probably better off to eliminate these animal proteins, at least for a period of time during the cleansing process. So anybody going on almost any cleanse, let's say 9 out of 10 patients I have, or whether, and it's the cause of their condition. So these people need to go for a period of time without these meat and animal protein. But again, I like to emphasize the main cause of this accumulation of toxins is just processed food, not eating whole foods, you know, eating things out of cans and packages and restaurants and pre-made foods or microwave foods. These are really hard to digest, accumulate in the body, start to blocking the channels, the sutra, as we say. And then when there's blockage in the channels, then blockage can lead to inflammation, damage of the tissues, and serious health problems. These processed foods. So you really want to eat all whole foods, all fruits, not fruit juices, and, you know, cooked or raw vegetables, not packaged or canned or frozen or microwave food. And, freshly prepared rice, freshly prepared, grains that are not old or been left in the refrigerator, or even leftovers, or can become not as healthy and not as alive as freshly prepared food. So freshly prepared whole foods, probably your best bet to avoid accumulation of toxins, as well as, good eating habits. So, okay, I think we've covered a lot there. I think you're too toxic, and you need some help to eliminate these toxins from your respiratory system to address, say, breathing problems such as asthma, bronchitis, or from your joints or muscle to help relieve you from pain and inflammation, and of course from your colon to relieve you from constipation. And of course, Ayurveda has certain treatments where we can take not just herbs, but enemas for the colon to clean out the colon. We put different herbs in the enema bag, and you put these in the rectum, in the colon, and then this, heals the tissue in there and helps to overcome this chronic constipation. Or different herbs can help with inflammation. Yes, irritable bowel, these type of inflammatory colon conditions. Ayurveda is treating by putting the herbs in the enema bag and then putting them in the rectum, and directly healing of the body. So if you need help in this area, feel free to contact me. Otherwise, I just recommend you watch more of my YouTube videos on some of these specific subjects. So thank you very much for joining me online, and thank you for coming here and being my audience. And I sincerely hope that I answered some of your questions. You have a better understanding of what are toxins, or in Ayurvedic terms, ama is, and how it's created, and how important it is to keep it on a daily basis. And when you do have a chronic health condition, relating that chronic health condition to this accumulation of toxins, and seeing that, getting to the cause and removing these toxins from the blood, the bones, the muscle, the fat tissue, or the respiratory system is really treating the condition and not just pacifying it. So I hope it helped you have a better understanding of health and how you can take care of your own health. And I hope this has empowered you to improve your own health. Thank you very much. Thank you. Thank you.